being patient. Can I start off with your name and job title, please?
Sure. My name is Michael Starky, and I'm a psychologist here at the university.
Okay. And can you please tell me your past experience? What led you up to work at URI?
So I did my PhD at the University of Minnesota, worked with the college student population there for my time in graduate school, and interned at the University of Maine, and then did my postdoc here at the University of Rhode Island. And I've really enjoyed working with college students. I've really enjoyed working with this population because it's such a exciting time and such a huge developmental task. The college years are incredibly difficult to navigate, also incredibly exciting at the same time. But I find that, helping people deal with that, helping people navigate this in a way that's beneficial to them has been really beneficial for me as well. So that's why I chose to do what I do.
Great. And what are the most common issues you see amongst students?
I'd say anxiety is way up there. Anxiety and depression are our top two. We see we're a very busy clinic, and the nature of anxiety has increased, I think, exponentially over the years, and I think that's what we see definitely as the number one issue that we deal with these days, followed closely by depression, and then all the other clinical syndromes that we see, like OCD, eating disorders, chronic PTSD, things like that, certainly are smattered in there, but definitely certainly the nature of anxiety and depression are the number one things that we see here.
And how do you recommend a student deal with anxiety or depression?
One of the things that we really have to look at is whether or not the anxiety or the depression is caused by situational factors, is a long-standing issue for this person, is a biological issue for this person. So for example, if someone's having anxiety related to school because it's their first time away from home, and homesickness is a proponent, we're going to look at maybe some behavioral changes, we're going to look at making friends, we're going to look at how to navigate university life, resource acquisition on campus. But however, if it's a more long-term or long-standing anxiety issue, we may look at medications, we may look at more intensive psychotherapy, dealing with some of the issues in the past that this person may have dealt with to lead to an anxiety disorder, for example, parental neglect, parental maltreatment. So not only do those things lead to anxiety, but also depression as well. So people who are depressed, maybe it's a situational thing where they did really poorly, or they are doing really poorly, and so it's leading to a lowered sense of self-efficacy, which can lead to a depression. And so if it's a situational factor like that, maybe they're in the wrong major, maybe they need to find a new friend group. However, if it's a biological issue where there's a family history of depression, we need to take a look at medications, we need to take a look at other aspects of that as well. Or if it's a long-standing psychological issue, from parental neglect, parental maltreatment, even experiencing a trauma, being abused as a kid, more intensive psychotherapy, maybe in conjunction with medication as well, can be used to treat those disorders.
Oh, great. And do you see any correlation with high stress management problems with high pressured majors, such as engineering, pharmacy, nursing? Do you see a correlation between students in those majors and stress?
Absolutely, yeah. The stress involved with, how we define stress and how we look at stress in general is like, when we have resources and then when we have stressors, if our stressors are outweighing our resources, then we're going to experience this idea of stress. And the high demand of the nurses, the high demand of the engineers, the pharmacy program here, they're fantastic programs. However, the demands that are placed on them on a day-to-day basis, on a semester basis, can certainly tap the resources that are available to some students. And I would absolutely think there's a direct correlation between the program and the amount of stress that one experiences.
And for those type of students, how would you recommend to alleviate stress and anxiety based on the studies?
To really increase one's resource base. And so when we look at stress, especially with stress, certainly we can get into a more clinical anxiety disorder or a more clinical like major mood disorder with a depression, for example, things like that. But I tend to see, and I'd say people tend to really come to me both with those, but also with an increasing level of stress, especially as the semester progresses. And so, resource acquisition and helping people navigate those more difficult majors, whether that be through, the research is telling us that, family support, friend support, and just social support in general is a really, really good way to increase one's well-being, increase one's feeling of not being so alone in the So, like talking to other nursing majors, for example, if we look at the nurses, talking to other engineering majors about like, all right, let's figure out a way to navigate this space. The Academic Enhancement Center, which is upstairs, is another wonderful place to get some tutoring, develop more effective study skills, develop more effective time management techniques, things like this. And so one of the things that I strongly push with people is to increase the resources to match the stressors in a way to help manage stress and things like that. Exercise. I strongly encourage students to engage in an exercise program. Cardiovascular exercise is really important to reduce levels of stress, to reduce overall well-being 3-4 times a week. To be able to do that, I think is really important and effective. A good diet is another thing to pay attention to. High proteins, high complex carbohydrates, fruits, vegetables, things like that. It's so easy to get sugar. It's so easy to get, simple carbs, things like that on campus, where you're going to get an immediate burst of energy, but you're going to get that crash later. And so a good diet, a good balanced diet, will maintain your biology through the course of the day. That help you maintain energy, help you maintain motivation, and things like that. And probably one of the other number one things I recommend too is good sleep. If you're not sleeping well, you're going to be fatigued. You're going to be not concentrating as well, and so a good sleep schedule is imperative to managing stress. So those are probably the top things that I recommend. Barring and other things too, psychotherapy obviously. If it's getting to the place where they're experiencing overwhelming anxiety or overwhelming depression, psychotherapy can really help people manage any clinical syndrome. And also if it gets to the point where they feel like a medication could benefit as well, I'd recommend that as well. So
Thank you so much. That was really good.